A global issue today is transgender inequality. Although the LGBTQ community is more accepted today, transgender people still face discrimination. From bullying and harassment to attacks on transgender people, the inequality remains strong. The LGBTQ community has been the target of massacres, ridicules, rights taken away, and discrimination. Transgender identity means identifying with a gender that is different than the one you were born with. Often transgender people say they have been born in the wrong body. Transgender people have daily struggles and face discrimination in multiple aspects of their lives. Discrimination has occurred towards the transgender community for ages. Native Americans use the word bearde, which is a European slurred word that is given to men who take on a traditionally female role. Thomas Hall, who was a servant in the 1620s, dressed in both male and female clothing. He was ordered by the Virginia court system to wear male pants and a woman's apron and cap to humiliate him. Joseph Lobdell, who was born as Lucy Ann Lobdell, lived as a man for 60 years but ultimately was arrested for wearing men's clothing and was incarcerated in an insane asylum. During the Civil War, there were at least 240 soldiers known to be of the female gender who dressed in men's clothing. Albert Cashier was born as a woman, but was unable to fight in the war due to being a female and dressed as a man to fight in the war and lived the remainder of her life as a male. Dr. Alan L. Hart was an American physician and tuberculosis researcher. He also happened to be transgendered. He was the first trans man to undergo a complete hysterectomy and gonadectomy. He did this under the supervision of a psychiatrist. In 1952, Christine Jorgensen was the first trans woman to have sexual reassignment surgery. She was drafted in World War II and was stationed in Europe. While there, she heard of sex reassignment surgery. She underwent operations starting in 1951. Later in life, when she tried to marry, she was unable to obtain a marriage license due to her license stating she was born male. Her fiancé lost his job, and the wedding was called off. In the 1980s, the American Psychiatric Association added gender identity disorder to the DSM, meaning it was considered to be a psychiatric disorder. If a patient wants sex reassignment surgery, it needs to be done under the supervision of a psychiatrist. In 2013, the APA removed gender identity as a psychiatric disorder and replaced it with gender dysphoria. This is an inner conflict between assigned gender and gender identity. This is still considered to be a psychiatric disorder. While the LGBTQ community is more widely accepted today, bullying and harassment is on the rise with transgendered youth. Federal law now imposes strict guidelines on transgender bullying and harassment. Title IX is a federal law that prohibits discrimination in the school system. It is part of the Education Act. In 2014, the U.S. Department of Education entered gender discrimination into the guidelines. The Equal Access Act allows for protection in the school system and allows for the inclusion of transgender youth into sports, clubs, and bands. The First Amendment is for freedom of speech. This includes the transgender population and their expression of identity. In 2017, President Trump overturned President Obama's guidelines and implemented a new set of guidelines. The old guidelines allowed transgender youth to use restrooms and locker rooms that corresponded to their gender identity. Title IX is part of the Education Amendment Act. It allows the transgender youth to be called by their chosen name and categorized as their chosen gender. It also represents the use of the right pronouns. With regards to harassment and bullying, there are harsher punishments. This includes expulsion from the school system, as harassment and bullying of a transgender student is considered to be a hate crime. The Education Act allows transgender youth to dress as they want to represent themselves as long as it obeys the guidelines for dress code. Title IX also protects transgender youth and their identity and identity status. This means that the student's transition status and gender identity are kept private. The LGBTQ community are at a high risk of being bullied and harassed. People view this community, especially the transgender community, as being different. As the pie chart shows, a high majority of transgender youth have felt unsafe in an environment where they should feel safe. There are long-term effects of bullying. The transgender community is already at a higher risk of depression, but adding bullying and harassment into the equation increases the suicide rate or suicidal ideation. They are also more likely to engage in high-risk sexual behavior and drugs. We head to the hospital when we need help when we are sick. The transgender community faces discrimination in the hospital. Many doctors are unaware of medications that are necessary for a transitioning transgendered person. Many transgender people are turned away from ER doors. Doctors will not treat or listen to their concerns. There is also the issue of identification. As a transgender person, identification is a huge concern and cause for anxiety. The individual may be categorized as the born gender, which increases anxiety in the person. Identification is a major cause of anxiety in the transgender community. They are objects of ridicule because they are trying to be the person they were supposed to be. In a hospital setting, being transgender means not only facing discrimination, but also concerns regarding policy and procedure or insurance. Being a transgender person is one sex living as another. Room placement becomes an issue. Majority of hospitals follow the same-sex rule. Placing a transgender person into a room with another person may cause discomfort. Policy now states that transgender people are placed in private rooms. The Affordable Care Act prohibits discrimination based on sex. The transgender person should be treated as the gender they identify with, and proper pronouns should be used. Doctors involved with a transgender patient need to incorporate hormone therapy and add testing for the identity a person identifies with. For example, transgender females need mammograms and transgender men need prostate testing. The way a transgender person is treated in prison is often unjust and unfair. Hormone therapy is not allowed in the prison setting, as being an inmate means you are not allowed the luxuries of the outside world. As a transgender person, this causes a transitioning transgender person to revert back to their born gender. Another inequality issue is that as a transgender person, you are not placed in a prison system that is based on the gender you identify with, but you are placed in a prison system that is based on the gender that you were born as. Being transgendered in a prison system, you are at risk for attacks from other inmates such as sexual assault, battery, or death. Prisoners often see being transgendered as weak and tend to use the transgender person, often forcing them into prostitution. Being transgendered in a prison system often means there's a probability that you will be placed in protective custody or isolation to reduce the chances of being victimized. As a population as a whole, we have to change. We should accept people for the way they are. Why should we prevent people from being who they feel they are? Humans in general should get equal rights and treated with just and fair action. In the school system, although changes in policies have been made, more needs to be done to make transgender youth feel safe. Adding LGBTQ education into the curriculum to inform students of the diversities in the world is one way to do so. Enforcing punishment for hate crimes and counseling for transgendered youth should also be provided. In the hospital setting, we should be treating patients based on need and about health care. Following policies in place to reduce anxiety for transgender people. Ensuring that transgender people receive the medical care that all people receive and being made to feel safe in a hospital setting is a big concern. A sick person should never be turned away from a hospital. In the prison system, no tolerance for bullying or harassment of transgender people. Adding punishment for hate crimes. And as for safety, having a unit that keeps transgender people safe and not isolated should be goal.